Hello, my name is Bill Main, and I've come here today with my wife Nancy because we are concerned about the way some of our national and state leaders are trying to combat the coronavirus. We're happy that Mariposa is now in Tier 4, and our leaders are allowing businesses to expand operation. But we're cautious because a few positive cases could bring us back to Tier 3 restrictions. Nancy and I have different backgrounds and different ways of looking at COVID-19. I hope that by combining our presentations together, we'll give you a broader understanding of the real risks of COVID and how we can step beyond them. But first, I would like to set the stage for COVID-19. I will start with a couple personal examples related to health, medicine, and big business that have affected my life. Back in the 1950s, the tobacco industry had a problem. A few scientists were publishing papers linking their product to cancer. This inconvenient truth was an obstacle to their corporate profits, so they invented social engineering and controlled tobacco science for the next 30 years. Now, my grandfather was one of my great mentors, teaching me about science and engineering. He also had smoked until he developed emphysema, and I remembered how much he suffered from that. Reflecting back, I realized how corporations view their profits as more important than human life. And then there is my experience. Back in 1997, I developed a tumor in my neck, and it grew. It grew large enough so I couldn't lie down, I couldn't sleep, I was in pain, it was horrible. And I was living in the Bay Area, so I went to the most respected medical center I knew, which was Stanford Medical Center. I gave them my scans and other medical information, and their tumor board considered my case. These distinguished doctors decided that the best course of action was to surgically remove the tumor, and because it was entangled with my right brachial plexus nerve, they would also amputate my right arm and shoulder. And I was in so much pain and fear, I would have accepted this extreme treatment. But I was lucky. One of my coworkers, who was a neurosurgeon, said that this treatment was too extreme and advised me to consult a different surgeon at the Mayo Clinic. This surgeon said that radiation was a better option even though my tumor was radiation resistant. He also knew that the radiation would kill my right brachial plexus nerve and paralyze my arm. But there was a chance the nerve would still grow back, and I would regain some of my arm function. Recovery took months, but it worked, and I still have my arm. This was a valuable experience in the importance of questioning a team of experienced doctors and finding a better way. This experience is also what started Nancy's interest in studying health and nutrition. Through her own research, she learned how important the immune system health is for recovering from serious and chronic illness. So I started to eat foods that would strengthen my immune system and avoid anything that could interfere with its function, including agricultural chemicals and heavy metals, which were hidden in many foods and medications. So flashback to the present. Big Pharma is looking to make $100 billion in sales on COVID-19 vaccines, if they can release them in time. Now, Big Pharma doesn't have a good track record for putting the health of its customers first, with examples such as the opioid crisis and pain medications like Vioxx, which was responsible for between 88,000 and 140,000 cases of serious heart disease. So as individuals, we must be cautious when deciding which medications and treatments are safe for us. Let's look at the steps leading up to our current COVID-19 outbreak. Back in 2002, we had the first coronavirus outbreak, where it infected humans in Guangdong, China, and then later spread to Toronto in 2003. Vaccine companies were eager to jump in and start patenting the coronavirus back in 2003. companies like Amgen, Novartis, Genesis Biotech, and the US government. But they wanted assurance because they knew that vaccines are risky. So they put pressure on the government to create the PrEP Act, which removed liability of vaccine manufacturers during a declared health emergency, which is actually what we're in right now. The government also created PREDICT. This was a project to fund researchers with $200 million over 10 years to hunt dangerous viruses that could move from animals to humans. Dr. Fauci of Erasmus University in the Netherlands demonstrated that mutated flu virus passage between species using ferrets and published this in Science magazine. In 2014, anthrax virus was released from a US government lab infecting 84 people in the United States. And concerned over these events, the NIH under the Obama administration paused this risky virus gain-of-function research, where gain-of-function means taking an animal virus and allowing it to infect humans, giving it the potential for infecting humans. Mark Lipsitch of Harvard published in Nature magazine that a laboratory accident could spark a pandemic killing millions. But in spite of these warnings, NIAID under Dr. Anthony Fauci continued to fund gain-of-function research. And as one example, there's a paper on bat gain-of-function. And in this paper, much of the research was actually carried out at the Wuhan Institute of Virology. It explains how they adapted a bat virus to infect human airway cells. It was funded by NIAID, NIH, PREDICT, and even the EcoHealth Alliance. It even expresses concern about whether these types of chimeric or multi-viruses studied warrant further investigation versus the inherent risks involved. Now in 2017, the NIH, at the end of the Obama administration, lifted the 3-year ban on gain-of-function research. And shortly after that, the US Embassy, concerned about what was going on, sent envoys to the Wuhan Institute of Virology to interview their scientists. And they sent out warnings back to the US government that there was a shortage of trained technicians and investigators. And after that, we all know what happens. In 2019, the COVID-19 emerges in Wuhan. The Chinese government said that it was in the fish market, but considering that the Chinese had 2 virology labs in Wuhan, the Wuhan Institute of Virology and the Wuhan Center for Disease Control, and both were studying bat coronaviruses, it's very likely that the virus was either accidentally or intentionally released. Now that we are in October 2020, and we have likely gone through the peak of the virus, let's look back and see what we can learn about how to approach this virus. I'm going to contrast 2 countries that took different approaches in combating this virus. Sweden is the blue curve and the US is orange. Sweden didn't enact many countermeasures such as masks, lockdowns, and social distancing, whereas the United States put emphasis on this. Now we can compare the 14-day death values for the US and Sweden, and you can see that in the beginning, Sweden had higher death rates, approaching 130 per million population, whereas in the United States, we kept it down to 100 per million population. But you can also see that in the US, the deaths continued months longer, even into the present. Now, I regularly interact with a major Swedish electronics company, and their workers were back on the job months ago, whereas my company has strict limitations on allowing only a few essential workers in my building. Another way to view this is to integrate the curves and look at the accumulated deaths since the beginning of the outbreak. Now here you can see that although the initial accumulated deaths in Sweden are higher, as we get into September, the accumulated deaths in the United States surpass Sweden. This shows that lockdowns may not lead to the best results in the long run. We can also consider the economic effects of COVID by looking at GDP, the gross domestic product. Though Sweden had about a 9% dip in the second quarter of this year, it was not nearly as severe as in comparable countries in Europe, such as Germany, Italy, France, and Spain, whose dips ranged from over 10% to over 18%. Through my examples and experiences, I've shown that there are alternative approaches to responding to COVID-19 and how important it is for citizens to question our regulatory agencies and big pharma in matters that affect our health. I'd now like to have Nancy come up and go into more detail about the hidden costs of lockdown and how best to respond to COVID-19. Thank you.
I am here to tell you why bold action is needed to open Mariposa. There's hidden effects of COVID restrictions, inflated death and case rates, successful and inexpensive treatment options currently available. Florida Governor Ron DeSantis is leading the way to open his state, and how Mariposa can get back to normal. Here, Dr. Bhattacharya of Stanford University says, if you think that having a lockdown will provide you safety, you are mistaken, because the problem is this lockdown has had enormous negative effects on the health of people in the United States and around the world. Here, Dr. Robert Redfield, director of the CDC, says, we're seeing, sadly, far greater suicides now than we are deaths from COVID. We're seeing far greater deaths from drug overdose that are above excess that we had as background than we are seeing deaths from COVID. Here he's talking about high school students. Our children are suffering, often from headaches, nausea, and anxiety from wearing masks, restricting their oxygen. Children aren't allowed to hug or touch. They're learning to fear people. Dr. Robert Hamilton, MD pediatrician, says fear is hurting our children. Dr. David Navarro, the head of the WHO's special envoy on COVID-19, said, the World Health Organization does not advocate lockdowns as the primary means of control of this virus because it's doubling the poverty levels and the malnutrition levels around the world. There are two main reasons why the actual deaths from COVID are lower than the numbers reported. First, the CDC changed the instructions on what qualifies as a COVID death from who died from COVID to who died with COVID. This new policy has met fierce reaction from many doctors, including Minnesota State Senator Dr. Scott Jensen. Second, hospitals receive higher reimbursements for those who die from COVID as compared with other diseases, thus giving them an incentive to report deaths as COVID. For example, Medicare pays hospitals $5,000 for patients who die from flu and $13,000 for those reporting a COVID death. People may also have died from coronavirus policies. We currently have a situation where COVID death rates in most countries are going down, but the COVID case numbers are rising. This does not make sense unless you consider that the increase in cases is mainly caused by increased testing. So now, instead of concentrating on COVID deaths, the media focuses on rising cases. And some people, such as college students, are tested as often as weekly, thus increasing the chances that a single person can be counted multiple times. There are also probable cases that can be reported together with the confirmed case numbers. The result is that case numbers are rising and people are living in fear for no reason. Never before have we locked down our people and our economy simply due to cases of a disease. Here, Governor Ron DeSantis of Florida shows the survival rates from COVID. After thoroughly educating himself and consulting with top scientists, Governor DeSantis decided to open his state. He says the fear of COVID may be unwarranted. First, Governor DeSantis educated himself thoroughly. Next, he had a conference with these 3 top scientists and doctors and asked them the questions that he needed to know in order to decide whether or not to open up his state. Next, he decided to open up his state. He's going above and beyond what any other governor is doing. Our California Governor, Gavin Newsom, tweeted that diners should wear masks in between bites while at a restaurant. Previously, he had tweeted to touch your mask as little as possible. These 2 things are contradictory and doesn't make sense. He doesn't inspire my respect as a leader. The Health and Human Services has declared a state of emergency. This activates the PrEP Act. The PrEP Act says that all goods created to help with the pandemic are free of liability. All people who make, handle, or administer these goods are free of liability. The FDA does not have to approve products for them to be used. It allows emergency use. So the COVID tests have not been verified by the FDA. The PCR test was designed to be a research tool, not to confirm a virus in the general public. It uses cycles to amplify a piece of genetic material. Right now, we amplify it 35 to 40 times. This process will magnify tiny pieces of a virus that may not cause an infection, thus creating a positive test in a person who would not spread the virus. According to a Lancet article published September 24th, this PCR test is estimated to give a 0.8 to 4% false positive rate. Thus, we could get a false positive in as few as 25 to 120 tests administered. Even under our new guidelines for small counties, Mariposa could be elevated to Tier 3 orange by only 7 cases. Also, the antibody test looks for antibodies from past infections. In some areas, a positive antibody test is counted as a positive case. Dr. Bhakti, MD, and Karina Rice, PhD, wrote the book Corona False Alarm. In this book, they say that for performing just 7,000 tests, PCR tests can be expected to generate at least 35 false positive results in a total absence of a virus. So if any government should decide they want a second wave, all they need to do is radically increase the number of tests in the annual coronavirus season. This simple manipulation will not fail to trigger the next laboratory pandemic. Hydroxychloroquine has been used safely for decades. Now hundreds of doctors are using it to treat COVID at a cost of $20 for the entire treatment. Hydroxychloroquine has proven safe and effective, especially with zinc, and can be used as a preventative tool as well, so you don't get a virus. In one remdesivir trial, 60% of the participants had side effects and 20% of them were hospitalized with multiple organ failure and other serious conditions, and the cost being at least $3,500, possibly more. There's also many natural ways with herbs and nutrition, vitamins, to increase our immune system's health. On this slide, you see in blue the countries that encouraged and allowed hydroxychloroquine to be used, and the red is the places that banned or discouraged it. Obviously, the percentage of deaths is a lot higher where it was banned and discouraged. We suggest using the Great Barrington Declaration, which is endorsed by medical doctors and public health scientists, to stop the harm caused by this lockdown. Use herd immunity to protect the vulnerable, adopt measures to protect the vulnerable as a central part of the public health response, open all businesses without restrictions. Arts, music, and sport and other cultural activities should continue. I'm hopeful that you can see that death rates are exaggerated and that case rates are not something to use to lock ourselves down with. We can choose to be free of these restrictions to our constitutional rights. We can get the facts from source material, not the news. We can realize that Google and other search engines and social media like YouTube and Twitter restrict our information so we don't see the other side of the story. We can have conversations respectfully with people that don't agree with us. We can be willing to try to reduce restrictions, especially on school children. We can be willing to learn how to stay healthy and reduce the fear of a virus. Thank you for being willing to listen to this presentation, and thank you for your time.